So he did a live recording in Waco?
Okay. There we go. All right, all right, all right. That was none other than the world-renowned artist, Mr. Brent Jones, and his hit song "Don't Wait Till Midnight." Well, as you can see, we actually have a full house. We have a full house. We have Lyric, Dr. Sharon Whitehurst Payne, and we have Dr. Aquila Weber. We have Dr. John Brown. I'm John Brown. John Warren. I didn't know who he was because he had the mask on, and so we're excited about him. You know, he's part of the at-risk population. Now, I want to let everybody know that he does not have the corona. You know what I'm saying? He's just making sure that he has his mask on. That just in case he cough, that y'all don't be acting like he done got the corona like y'all just did a minute ago with me, Lyric. But also we have on the line none other than Pastor Miles McPherson, and I wanted to bring him online because got Pastor Warren here, you know, and the church community is going to be greatly affected by what's going on because of the fact that they said that 250 or more people shouldn't gather together, and I thank God that these churches have that issue, that they got more folks that are gathering and what's going to take place. So, Pastor McPherson, how you doing this morning?
Hey, I'm doing great. Thanks for having me on. And hello, everybody. Sorry I couldn't be there. I got some other things I got to deal with this morning, but I'm honored to be on the show.
Yes, yes. So I know that there have been conference calls that are taking place among pastors, and there are conference calls that will take place today. What is the game plan from the Christian community that you know of thus far, and how we're going to move forth during this coronavirus crisis?
Well, everybody has a different situation, but the bottom line is we can't meet. So we want to show our services online. And the conference call that I'm having today is to talk vision and strategy with pastors. Some of the practical things, how do you get online? So we're going to help pastors who don't have online ministry start Sunday. They can actually fire it up today and have people watch online and give their tithes online so they can be operational and by Sunday. And so the other thing is that we have a clear vision. This is, the Bible says that we have not been given a spirit of fear, but of power, love, and a sound mind. We can't think defensively. We have to think offensively. How can we minister to our church, staff church, and then the community at large? And so we got to be in tune with what the needs are of the community. Obviously, we have to stay safe, but we have to think offensively and not like the devil trying to get us, and this is the end of the world, but this is an opportunity for us to step up and show who we really are as God's children.
Amen, amen. So you have a multiple campuses. You have a large employee staffing. What are some of the protective measures you're doing in, I guess, sanitizing the campuses and also protecting the employees that are working?
Yeah, I mean, every day we're learning more and more. 2 days ago, I was talking to the health department here in San Diego, and they said, "Oh, we're not going to close things down for a while." And then the next day, they close things down. So we're learning every day. Last Sunday, we were wiping everything down between services, not shaking people's hands. Even an altar call, we just give fist bumps. And so now it's a whole nother level. We're canceling a lot of our meetings. I have a preaching class that I do every 2 weeks on Tuesday night. We're going to do it online this Tuesday. And so it's every day we're learning more and more to be more cautious, and we're learning more and more the severity of the problem. But those are the things we're doing. And I think we need to realize this is not 2 weeks. We have to plan for this to be 3, 4, 5 months. And life is going to drastically change. All bets are off. And that's how we got to look at it.
So let me ask this other question. The educational schools and things that you have, are they closed or are they still moving forward?
As of yesterday, they were open.
Okay.
Every day is different, And there's debate about whether closing schools is the best of both evils, because if you close schools, then parents got to take care of the kids. Mm-hmm. And 35% of nurses and medical employees have kids in school, so who's going to take care of people? It's a domino effect. So the kids don't necessarily get sick. Yes, they're carriers, but where are you going to put them? If you put them in a daycare with other kids from other neighborhoods, now you got a double chance of them getting sick. So it's not a simple solution, and I don't have the answer, but not everybody around the country is closing schools, so it really doesn't necessarily solve the problem. It just creates another one.
Okay. Lyric, you had a question?
Yes, this is kind of going to take a different angle because, of course, we know all the concerns about just for the health perspective. But I have a question for you, Pastor. Just knowing that you have a very large ministry and you're very influential, I would like to know, how does this change the message? Because I know that a lot of pastors right now, they're going with the prosperity sermons and different things like that. And so how does this affect the message that from leadership and shepherds, as far as discussing prophecies, things from Daniel, Matthew, Revelations, as far as the times that we are living in and what people really need to know, the message and the truth that we need to be to get out? Because I know that a lot of, especially mega churches and things like that, they kind of stay away from revelations and prophecies and the times, the sign of the times. So how do you think this would affect moving forward the messages and the sermons that are being delivered to the congregation?
Well, I can only speak for myself. I don't know when Jesus is coming back. There's been so many different things that happen through history. Our people are thinking, what do I do today? How do I keep myself safe? What is my Great Commission mandate today? How do I draw closer to Jesus today? Because, there are a lot of people who take God for granted. They don't pray, they don't read the Bible. They come to church every now and then, and they don't tithe, they're not faithful, they're not being blessed financially. And now they're going, oh snap, what do I do? Well, they don't want to know a theory that maybe Jesus is coming back. They need to know, how do I get my life right with God and put my feet on solid rock and be a citizen of the kingdom today?
Mm-hmm.
So that's what my message is going to be. I'm going to have some people from the health department and some mayors that I'm going to interview Sunday, but I'm going to be talking to them about what can we do? How do we stay safe? How can we serve the community? I'm going to challenge people to not be fearful, but to be careful. Have that social distance, but don't have emotional distance. So we have to be functional for the kingdom of God today.
Well,
Okay.
we're excited about this. We have in the room Lyric, Dr. Sharon Whitehurst Payne from the school district, Unified School District. We have Dr. Aquila Weber, medical professional and MD. And we also have Dr. John Warren from The Voice and Viewpoint as a publisher, chief and all that, and also a pastor. I want to pitch it to you, Dr. Warren. Thank you for coming in early. We see that you are adorning a new look. But it works for you for the day. So, Dr. Warren.
Pastor Miles, good morning. How are you?
I'm doing great. How you doing?
I'm doing well. I want to make a couple of observations. I want to thank you for the comments that you just made. When people follow the word, Jesus was never at conflict with government. He said, render to Caesar that was his, and unto God that which is God. And Paul gave us all kinds of directions in terms of following instructions and the things that we'll do. So I think the biggest part of this is we're going to have people's attention at this point. And a lot has to do with the foundation that the speakers have in reference to the point that the sister was raising about the message. Our messages are not things that we sit down and create ourselves according to what man says. But those of us who speak the gospel do so from inspiration and direction. And so I think in our community, there's an observation. I'm concerned. Most of our churches, as you know, Pastor Miles, are probably 100 people or less. So they don't even reach that 200 category. They'll be 40 or 50. We're less than 100. There's also a need for us to exercise diligence, but in our community, at least according to Google, unless I've missed it, the large segment of our community is not online. and will not be able to get online. So in some smaller instances, there might be conference calls with some small congregations in terms of people continuing the discussion. But I think that we, as you said earlier, we have to remember that Scripture says that God has not given us a spirit of fear, but of love, power, and a strong mind, and that we need to be sober in how we approach this and not panic. I don't think the believers will panic. I think the panic will come from people around us.
Mm-hmm.
I've often said if we had a major earthquake, I would open the doors of the church and stand back and watch everybody rush in like that was going to get them saved. And so it has a lot to do with the mentality of people as we go forward.
Yeah, if I could speak to that, a couple things. Everybody that has a cell phone, which is pretty much everybody I know,
Right.
Is online, and what we're going to give them is the opportunity to have church on their phone. You could just speak right into your phone to your congregation.
Great.
It's going to be really simple through Facebook. And the other thing is that if they have less than 250, they should have church as long as they can be safe, but that number of 250 may go down.
It probably will.
I think it's North Carolina, I think it's either 100 or 50 people that can't assemble. So it's better now to get ahead of the curve and figure out, and like I said, we're going to talk about this today, how to figure out how to use Facebook, Instagram, just do a quick message on your phone to your people and get electronically connected. That's not a hard thing to do.
So one of the reasons why I have the key people here today is because I want to make sure that those that are tuned in on Facebook, that you can ask questions and get things answered. I know, Dr. Warren, that the paper has already came out yesterday, but I know that you're going to be a great resource for additional information that people are going to be able to get as we go through this transition.
Oh yeah, we're doing electronic. We'll be doing online updates. We've already been in touch with the county. The county is designing some messages for us to reach that targeted population. And we do have a target population. Remember, many of our people are older and many are homeless. And one of the reasons I'm wearing this mask is that, I'm facing 75, and my doctor told me yesterday to stay home, put on a mask, and it's more for my wife's protection, whose immune system is compromised, than it is for mine. So we have to be concerned about the people around us that we can hurt, even though we might be healthy ourselves.
Mm-hmm. And for those of you guys that are going to wear masks, I do want you to have some Pentecostal mints so that as you are walking around, that you smelling your own breath, make sure it smells sweet. Because, sometimes folks be like, ooh, I didn't know it was that offensive. Mm-hmm. So get some Pentecostal mints and make sure that you have them. Dr. Aquila, let's talk about just some protection things for our kids, because we always say kids are like little germs that they just bring them to you, and we get sick and the kids just be playing and happy, and they bring us germs. So what are the things that we're doing with the children and teaching the children?
Thank you for asking. That's a great question. And even with my own kids, I've been watching them wash their hands and reminding them to get in between the fingers. I thought one of the things that was very innovative at my boys' school is that when they walk into class, their teacher gives them some kind of sticker that really sticks to your skin. Mm-hmm. And at the end of the day, if it's gone, then they get a prize. And so what that's saying is that you are constantly washing your hands to get rid of that mark on your hand. And I was like, that is very creative. That's very innovative. And, you can do that at home, even if your kids end up having to be at home, like putting some kind of mark on their hand and saying, if this is gone by a certain period of time, then you get something. And so my kids are excited, like, oh, I got my fluffies, or I got some Skittles, or I got this, or I got that, because they have always made sure that they wash their hands throughout the day to get that mark off. I've also told them if anybody's coughing, make sure you kind of step back.
Run.
Because you need that, that 6 feet distance between you and someone who's coughing. And, if they have to cough, do it in their elbow like this and not just spread it around to everyone. But those are the things that we should be talking to our kids about.
Okay.
It's shocking to me how many adults cough and do not cover. It's like,
Yes.
now
You see
where were
all of
you
it.
raised?
Yes.
So, you know, and they wasn't from Terrell, Texas.
They're not from Terrell, Texas.
Terrell,
We know,
Texas.
we know how to cover our mouth in Terrell,
Yeah.
Texas.
So let me go. I'm gonna pop back to Pastor Miles. Your church is known for being a big helps ministry and giving ministry. Are there any additional plans to do food banks or anything around because of your many different campuses? And I like to applaud Pastor Miles because of the different campuses and the different type of pastors at each campus. You could have never told me growing up with Michael Whitley that he would be a pastor because he was such a prolific musician. But he is really doing a great job at Mid-City, and then you got Pastor Greg and all these other amazing pastors. Is there a game plan for any type of food bank or any type of helps ministry from your ministry?
Good question. A food bank is one of those things I wish I had, and I'll probably try to figure out how to get one in the next month or so. The first thing we're telling everybody is to be safe, and so however they serve, whether it's deliver food, we may partner with the food bank to deliver food, but we haven't had that conversation yet. We're now just we're trying to respond to not having church Sunday as first response and get this website up to faster, which I'm looking at right now for part of you. But all the services and all the ministries that are in the community, they have to think, how can I continue to do what I'm doing and stay safe? Because we got to stay safe and you know, as much 6 feet apart from each other, which is so unnatural. And so we don't have any concrete plans. I'm going to be talking to the director of the food bank and other organizations to see how I personally can help get the word out for them. But getting people in the room, we have to think through all of that, and that's what we're in the process of doing.
Okay, excellent. Dr. Sharon, any updates?
Just to bring folks up to date.
Can I say this? I want y'all to know how powerful this is. You are literally looking at the power structure of San Diego. You have some of the biggest influencers on the telephone and in the room right now because this is how important they see this crisis is. And so I'm humbled that you guys were able to take the time. Dr. Sharon, go ahead.
I was just going to say that LA Unified is still in closed session, but we're trying to do a joint press conference with them as soon as they come out of session to announce that we are coming together to say that we are closing schools. It's not a matter of if, but when. Mm-hmm. And as a part of that, we're looking at the food issue that was just raised. We in the district know that a lot of our children get their breakfast and lunch at schools. And so we are we found a way to package the lunches and the foods in a bag so that they can walk through or drive through the school area and pick that up so that they are not missing out on their food. We are not even checking to see whether or not they are eligible for it or not. We're just going to put the food out there and pass it out as they come through. We're looking at ways that we can do educational pieces. I talked about the electronic part of it, but also the hard copies. And then we're looking potentially at a television station to see whether or not we can get the lessons out there.
Mm-hmm. Because most of our kids have their own computers, but if they don't have Wi-Fi at home, exactly, that then eliminates them from being able to get the lessons. And so I want you all to see how big this is when your district is saying that we're trying to get a network, a TV station, so that we'll be able to teach on. And I know that the county has, is it called ITV or ITTV? And they use that. But everybody, it's like, how do we work it together? Because we have, I believe, over 40 districts that are tied in to the County Office of Education. So this is a major task. And I can imagine, and I'll ask you this, are other school boards getting together? Are there conference calls happening all over the nation with school boards trying to figure it out, or how are we just staying in California?
Well, as you know, education was assigned to the states by the Constitution, U.S. Constitution. So it's pretty independent, but there are several states that have already closed down statewide. And California, we tend to do it on a regional basis. However, if the governor says that he wants all of them closed, then obviously we're closed immediately. But right now, as a district, we're looking at cases that may have come up here in San Diego, as well as in LA. But we know that proactively, if we can reduce the amount of spread that's going through the system, through the city, through the area, then we won't have that spike that the health system, the folks are really concerned about. And you can address that. But if we can just have people not to get together physically and just minimize the amount of contact, we won't be able to spread it. That's why they shut down the arenas and so forth, because contact is the way they're getting it.
Yes, now I do want to say for husbands and wives, that don't mean that y'all get to sleep in separate rooms now.
Well,
you know, just make sure that y'all both healthy. You know, this is the time that we might be fruitful and replenish. Praise the Lord. Dr. Warren,
Why ain't come to me after that?
you have been, and the Voice and Viewpoint has been a beacon in our community for over 60 years. How is the message, and what is going to be the focus as you move forth? Because I always say that your paper can be educational, it could be informational, but then sometimes it's just like a resource book or a resource pamphlet for what we're supposed to do next. So what is the direction that you all are going to head in as we go through these next few months?
Well, one of the major things we're doing right now, and we started earlier this week, working with the county so that we can partner with the kind of messages that we're going to put out. We still have the population that's most vulnerable, those who are 60, 70, you know, my group. A lot of those people are not on social media, and we still have to reach them through print. And so what we're doing is not only are we moving in the direction of doing it through print, but we're also trying to link and direct some to social media, and hopefully their children or grandchildren will help pass the information on to them. And that will be an important way of approaching it. We're basically going to be updating every day because the changes are daily. So we're going to be working with this on a daily basis. In terms of e-blast and information, and a number of people, when they get concerned, they just call us because they're looking for direction. And so we're going to be online, but we're also physically, because our staff is dispersed. We're not all in one place. We're in different cities and locations, and we do a great deal of our work through Google Doc and the internet. So we will be in the office for local people, but we'll still be coordinating this information from other sources.
Okay, Dr. Weber, game plan from the medical, you know, because you know everybody get a sniffle and everybody's in the emergency room right now. What is the game plan, and are you all now on 24-hour call? Are they calling everybody back off vacation? What is the medical situation looking like right now in our city?
So let's review some of the symptoms of, you know, coronavirus. Because oftentimes people say that it starts off like a regular cold that just doesn't go away. And then you end up developing like a fever, cough, you feel very tired, your muscles may be weak, get some shortness of breath. People say, do I have the flu? Do I not? And that's really when you need to come in to be evaluated. One of the issues that we've had throughout the country has to do with testing and the availability of testing and the timing of actually getting the results back. We are working on that here in San Diego County. The county is able to do the test. Some of the universities, UCSD is now able to do the test in-house, which allows for people to come in, get it, and then get results quicker than what we have been hearing in the past. So in the past, you may have heard of people coming in, getting tested, and then they find out 2-3 days later that they're positive, and by that time they've gone back out into the community. And that's because we did not have the ability to do in-house testing here. We were shipping it off to CDC or somewhere outside. So now the county can test, UCSD can test. A lot of other places are gearing up to have their labs be able to test in-house so that those results can come back within 2-3 hours and we know what the status of that person is. And let's not also forget that, you know, when looking at the people from China, looking at the studies from China, about 80% of people that get coronavirus have very mild symptoms, that they don't need to go into the hospital, they don't need to go into acute care. And about 15% will need to have some kind of acute care, whether you go, you know, to the emergency room, you may be admitted for a little while, and then you're able to go home. It's only about 5% of people that really need that intensive care where they end up on a ventilator. So we always need to keep that in mind when we're talking about this particular virus, because a lot of times when we hear about it, because we haven't been doing mass testing, it's because we've heard of someone who's on a ventilator or who's passed away from it. But remember that the vast majority of people that get it, especially if you're under the age of 60 and you don't have any other comorbid conditions, it is mild.
I have a question for Pastor Miles.
Yes, go ahead. Pastor Miles, this is a question for you.
Okay.
You said that you were doing an online training or something. How do people access that? How do pastors listening access that training so that they can go online and do it?
Mm-hmm. So, Pastor,
if you text the word Zoom, ZOOM, to the number 52525.
52525.
Yep, the word Zoom.
Uh-huh.
And I remember listening to me talking about big pictures, pastors, how we, one way to look at this, not how we need to, but one way we're looking at it, what we're doing, and then give some direction on how you can set up an account on Facebook where people can watch you and then give, and then eventually set up their own link where people can give anonymously. I think on Facebook people can see, but from 1 week that might not be that bad. And then resources online that their congregation can do children's church at their home. So if they stay home with their kids, they can do something with their kids. And so, you know, in the short run, if you're a church that doesn't have streaming, you know, you could sit in your living room and give a message and have all your people look on their phone. And then they have something with your kids to call you out on the phone. You can still stay in contact with your people.
Okay, here's one from online, and it says, why are we giving this virus so much power? That's the question. We had and have more ways to spread fast-spreading worldwide epidemic. So I guess the question is, why is this virus getting so much attention? And I think that you answered it before was because we got into the game late. Mm-hmm. And China knew about it last year and didn't tell anybody, and we still wouldn't even know about it if the doctor didn't breach and basically say, look, we got to tell the world.
Right. So we got into the game late because we found out about it late, and then when we did find out about it, we did not move and prepare ourselves appropriately. Mm-hmm. And so that's why we're giving this virus is getting so much power, and it's because we don't have a lot of information, right? I just said that we're not hearing about the number of people who have it and aren't really getting that sick from it. And we don't know that because we don't have testing for that. So we can't say that 1,000 people have been tested and are positive for coronavirus, and of those 1,000, only 5 of them end up in intensive care. We don't have that information. So when you're looking at other viruses like the flu, we have that information. You know, we're prepared, we have vaccines, we have adequate testing for it. So we have that research and that data to really give people that sense of calmness, that the chances of me actually getting this and dying from this are very low. We just don't have that yet with the coronavirus.
So I want to ask Dr. Warren, do you think that criminal charges or world criminal charges will be brought against China for holding out so long?
No, I don't think so. That's not likely to happen. Okay. But I do have a question, Dr. Weber, because I've noticed from some of the clips I've seen in China of the doctors in full protective gear standing at the doors, and they have a device in their hands where they're like screening people. Mm-hmm. And I'm wondering, how is it that they have a device that seems to detect whether or not a person has the virus on the spot, but we're still going through the lab? Has anyone addressed that issue? or is that device doing something other than checking the virus?
Right. So that's a great question. And what that device is most likely testing is just your temperature. And so, for example, when I was recently traveling internationally, I believe it was in August when we were traveling back to Kenya, they were screening people for fevers when they were coming through. And so that's an easy way to detect it because coronavirus, one of the main symptoms is a fever. But those are very easy things that we can do. There are countries that are far advanced in terms of testing. You know, South Korea has drive-through testing centers. So, and they got the idea from looking at us because we have drive-through Starbucks. So they said, oh, they have drive-through Starbucks, we can do drive-through testing centers. And so what happens is people, if you're feeling sick, you drive to these centers, you stay in your car. There's someone who is gowned from head to toe that does the swab, and you go home, right? So you're not coming to the hospital, potentially infecting other people. You know, the results come back fairly quickly. They can let you know, yes, you stay there, or no, you're fine. So there are countries that are able to do this. We are just very much behind the ball at this point because, like I said, we did not prepare once we got that information.
Okay.
Hey, then I have to one.
Yes, sir. Any final statements?
Yes, two things. One, thank you all for everything you do at San Diego. And also, if any of you need any volunteers that to do, especially feed the kids at the food line, however, just let me know. And if we can do that and people feel like they're going to be safe, we would love to do that.
Well, there you have it. That is Pastor Miles McPherson, Senior Pastor of the Rock Church. Thank you for spending some time. And if there's anything we can do here at GOD Radio to continue the efforts, please reach out to us. And we want to make sure that we're a resource not only to the local community, but to the world. So thank you, Pastor Miles, for your time. Dr.
Who shall we go through to get volunteers? Just general rock?
You can call, email the church, Debbie, DEBBIE, .Smith at sdrock.com.
Okay, thank you very much for
And
that.
if it doesn't go through or something, just call and ask to speak to my assistant. She's gonna split when all these people start calling.
No, but I at least will use it, Thank
All
you.
right, Pastor Miles, thank you so much. Have a blessed day, and we'll look forward to talking to you soon.
Thank you.
God bless you.
God bless you.
All right.
So, we are back here, right here on GOD Radio 1. We still have in the room, and we have about 15 more minutes of this show. Lyric, Dr. Sharon, Dr. Aquila, Dr. Warren, I appreciate y'all. So I'm going to turn over this last segment to any questions that are either coming off of Facebook or that you all want to address. I also want to make sure that everybody gives their contact information of what they want, if people want to tap into you. And then as you as an elected official, anything you want to say to your constituencies out there to make sure that they feel like they're fully getting all their questions answered and having the resources. So anybody can start at this point.
Well, I'd like to start by addressing an issue that is not being talked about a great deal. Two things. The president's been talking about payroll tax, and that's ridiculous in reference to the problem. Speaker Pelosi and members of the House are preparing a stimulus package, which is going to be similar in many ways to when we had public service employment under CETA. And what we did was we gave money to municipalities for firefighters, teachers, and public officials. Those are the people who are on the firing line. We also have to step up the whole concept of extended unemployment insurance and employment insurance now, because these items come under what's called a social insurance income security net. And most of the times we've not talked about it, and we have a situation where because of political issues between parties, the party in control, the Republican Party, has never been in favor of these programs. Now we have to look at these programs because parents, people are without jobs, they're without checks. and we've got to get money into their hands, and so we want to make this happen. And the system is capable of doing that. It has done so before. 40, 50 years ago, we got out money to people. We went by single member district census tracts in terms of where to put the income. And so we need to gear up even here in California and start preparing to see how we're going to deal with some of those items that are falling off the radar because they're not big.
Well, and you also just said, when you said census, that also spurred a question. How do we feel like this is going to affect the census count?
Well, we would hope that that the campaign will be ongoing. Should be more people at home in terms of reaching them that wouldn't have been reached before. Mm-hmm. The question is, are they going to be afraid to open the door because of the kind of foolishness that's been put out, that ICE is coming and you can't really let people know who's there. And so I think the census effort should continue, and I think that we will reach people in many ways that we might not have reached before.
I think that if a message could get out that they should fill out the forms themselves and mail them back in, then you don't have to have anybody coming to your house.
Right.
Mm-hmm. That's the key. If you get ahead of the game here and you go ahead and when the forms come in, and I understand they should be in the mail shortly, when you get that form, fill it out, send it in. No one will contact you. If you don't do it, that's when they start contacting you at home.
Right.
And you can eliminate that just by filling it out and sending it in.
And some of them are being done online.
Or online or wherever, just.
Yes.
So, Dr. Weber, here's my thing. I didn't fill out my census because I don't know where the mail came from, and they said it could live on surfaces for so many days. They still haven't figured out how likely is our mail going to contaminate us? And that might be an excuse for people to say they ain't going to pay their bills because they couldn't open up their mail.
It's unlikely.
Okay.
Highly unlikely, because when you think about it, by the time the mail gets to you, it has been touched by so many different people. It's been sitting there for a while. So the chances that you would contract coronavirus by touching something or some mail is low. However, keeping that in mind, that reminds you that you need to constantly wash your hands. We talked about the 20 seconds, using hand sanitizer with at least 60% of alcohol. So if you have some, just make sure that you've got the right kind. Avoid touching your eyes, your nose, your mouth if possible, because that's how we contract this virus. And so if you're concerned about that, get your mail, open it up, wash your hands before you do anything else.
But Dr. Weber, I'd like to add something because I became aware of this. Some years ago, we used to sell survival bags to Voice of Viewpoint. So I have a lot of exam gloves and all kinds of stuff. And so I put a box of exam gloves in my car. And when I stop to get gas, I will put on one of those gloves so I'm handling the pump. And when I finish handling that, I can dispose of the gloves. So the doors that we open and close, we're not thinking about it. And you want to always, and even though I keep the sanitizer in my pocket and on me, I still use the glove for the hand that I'm using, and we have to have that kind of sensitivity over a period of time, because I've seen people on television talk about the virus, about not touching your face, and they're touching while they're making the announcement, they're going into their face.
And bathrooms, I never touch it. They will wash their hands and then go right out and touch the door. And there are people who get up and don't wash their hands, so you can't touch the door.
So that's a very good point about the gloves. And when you wear a glove, you just have to be a little bit more cautious and sensitive and remind yourself, because sometimes we get very complacent when we're wearing a glove and we're just kind of touching a bunch of other things. And then we take the gloves off and we're touching those same things that we touch with the glove on without sanitizing it first. So if you do wear gloves, just remember where you touched, how you're touching it, and then after that, those things need to be, wiped down as well.
Yes.
Okay, final words. I'm going to start off with Lyric, because you're Lyric, you're a substitute teacher, international evangelist, artist, singer, all of that other stuff you learned to sing this morning on Wake Up Morning Show.
Thank you.
how's it affecting your touring? I know that you got a gig this weekend, but have they been canceling a lot of your tours?
Yes, I've been getting a lot of calls about I was doing the Indie Impact Tour this summer.
Yeah.
And so definitely have been getting some calls, so that's going to be affected. Unfortunately, I'm waiting to hear about my event on Sunday. If that gig's going to be canceled, I'm sure if they're shutting down churches for Sunday service, then I probably won't be at that church. And so it's going to have an impact, but, Jehovah Jireh is my provider. And so I think that we just have to go with this thing as it comes, and I'm not worried, I'm not worried.
I'm not
God
worried.
favors me.
All right.
And so, y'all just be blessed. These are my final words that I'm giving right now. Okay, well, y'all just be blessed out there. Tune in, because Dr. Thompson going to have us in here till I start coughing real good, then he'll send me home. So y'all be here next week, and we'll be keeping you entertained while you entertain those children who will probably be at home with you. Y'all can tune in to Gospel on Demand. You know what I'm saying? Times like this, we need the gospel. And so y'all tune in. Let love be the foundation and the motivation for all that we do.
Praise the Lord. Dr. Whitehurst Payne, final words.
I want to thank you for this opportunity to come and share this morning with your audience and with our people, because bottom line is the district is trying to look out for their children, as we all should be. And we're doing everything we can to keep them safe, one. Two, to provide for their educational needs. And even more importantly right now is their food, their nourishment. We're looking out for that aspect of it also. So just know that we're available, and feel free to contact us.
I also want to get you back on here because I just heard of a very innovative move that you made in your area with a former principal. And so that I heard it's going to be state-of-the-art, kind of forward thinking, and would love to have you come back and talk about the plans and the direction that you're going to be doing with that great move. And so kudos to what you're doing. We're going to save that for another program, but I wanted to let you know that, that thumbs up in that area.
Thank you.
All right, Dr. Weber.
Well, first, I also want to thank you for having this. It's really important to make sure that the correct information is getting out there. I was watching CNN Town Hall last night, and I think it was Anderson Cooper that said, facts saves lives. And so making sure that we're getting the proper information out to everyone is important. Just, remember, everyone, do those preventative things. Stay home if you're sick. Stay home if you're sick. And also, utilize resources that we have online. So go to your city's website. In the city of La Mesa, we're constantly updating it daily on the status of the coronavirus. The county has a website as well. And also utilize the CDC, the Center for Disease Control. They update their website on a daily basis as well. So those are 3 great places where you can go to get information about coronavirus, not only nationally and internationally, but also locally.
All right, thank you so much, Dr. Weber. Dr. Warren, from the desk of the editor every Wednesday night, we had a good time talking about the coronavirus this last week. Any final words, any direction that you want to take as we move forward? And I do want to say that one of the important things is that through the vehicles that we have here, the black box and the radio station, we want to make sure that we worldwide are a community resource. So this is not we will not only go live on the air during program showtime, but if you all call and say, look, there's a major thing and we need to get out to the people, we will preempt programming to bring us back together, even if we have to use wherever you're from and dial you in. But we want you to be able to know that this is a resource to you that is not about when we feel like should come on. This was really built based on the needs of the public to know. And so I thank you one and all for at least being willing to come at this early hour to share with the population. Dr. Warren.
Well, again, we have this partnership with GOD Radio 1, and I'm in touch with our major African American publications and media outlets around the country. And so we're sharing information in terms of the impact on our communities, because we know that we're often hit differently. And so I also think to Dr. Payne, We want to consider there might be some churches that can be used for the food distribution in addition, because everybody won't be able to get to the school to drive to pick up. And, you know, we feed the kids through the summer. I was one of the staff authors of the School Lunch Act in its original format. So I'm glad to hear that
Thank
you're
you for
not
that offer.
checking the kids in terms of reduced price and who has a slip, and that everybody's being fed. You know, Bell, Black Men and Women adopted Bell Middle School, and we do backpacks that we give the kids to take home on the weekend because we know they need to eat beyond Monday through Friday. And so I'm encouraging, the paper will be sharing. I'm very concerned about our older population that's not being reached, and we're going to make them a major focus of what we try to do.
Excellent, excellent, excellent. Again, I'm truly blessed. Musical artist and icon, educator, woman of God, you know, MD, doctor, woman of God, publisher, icon, lawyer, all of that, man of God, all coming together for you. And I'm going to end off with the song that simply says, Pray, Don't Worry by G.I. Right here on GLD Radio 1. Y'all have a blessed day.
Pray, don't worry. 1, 2, 3, 4.
Give me a mountain and I promise to move it. Show me a valley, I'll walk right through it. I ain't worried. No.
Thank you all.
All right.
Nice. It's very good. Thank you
It's
for
great.
being on top of this.
So Sharon, don't let your people forget interacting with us like the county is doing here. I mean, in other words, like for the information that we're getting out, like I said,
Yes.
I'm always, the county, we started like
All right,
2
people,
years or so
be blessed.
working